the home of inspiration every day.
Most people give up on themselves easily. You know the human spirit is powerful.
From news,
countries across the globe have been hit by the COVID-19 virus.
views,
There's a global trend to see an increase in GBV incidences, specifically domestic violence.
sports,
What's he say? It's a really good ball. It's Shabalala.
and music to inspire you every day. This is Vuka Online, your inspiration radio station.
Hi there and welcome to another show. This is Healthcare Hour with Colleen Qvist. Thanks so much for all your messages during the week. Thanks for reaching out on social media. And as you know, Healthcare Hour is all about healthcare professionals. It's about us understanding that they're people. It's for us to improve the relationship between the healthcare professional and the patient. And as the public, we can't be ignorant. We need to be empowered. We need to have information that we can trust. And we need to know that we are in charge of our own bodies and know what's happening in them. More about Vuka. Vuka is your inspirational radio station. We are inspiration on a radio platform as such, but obviously with our different platforms, you also get to see video. And more about Vuka, people often ask me, okay, what does Vuka mean? And Vuka, V stands for vision. So we're there to work with, improve the vision of our listeners. U is understanding. We want to challenge their understanding. K is increase their knowledge. And the A is we need to inspire people for action. It's pointless. We just talk about problems and go round and round and round. We need to come up with solutions. So after the break, we're going to meet my guest today and a different aspect of healthcare. But let's go for that break.
The home of inspiration every day.
Most people give up on themselves easily. You know the human spirit is powerful.
From news,
Countries across the globe have been hit by the COVID-19 virus.
views,
There's a global trend to see an increase in GBV incidences, specifically domestic violence.
sports,
What's he say? It's a really good ball. It's Shabalala.
and music to inspire you every day. This is Vuka Online, your inspiration radio station.
Welcome back. You are listening to Healthcare Hour with Colleen Qvist. My guest today is Mia Malan. And Mia is the founder and editor-in-chief of Bhekisisa. And Bhekisisa is a Centre for Health Journalism. Mia, thank you for joining us.
Thanks so much for having me, Colleen, and for your interest.
Awesome. So Mia, we're all about people first. Let's hear about Mia and who Mia is before we jump into Bhekisisa.
So I'm a health journalist, and a health journalist from the perspective of looking at policy, health and social justice policy, and health politics. So my sort of like North Star is to make health issues understandable and to mainstream them. So to take science and policy and combine it in such a way that people would know how it affects their lives, so that it's not something far away. When I studied at the university where I studied, Stellenbosch University, you had to study something before journalism, and then you could do a postgraduate honors degree in journalism. So I have a health background. I studied speech therapy and audiology, and then I did journalism. So I was always interested in a health sort of aspect of it. And I then had my first job in the rural Eastern Cape at the SABC. And from there, I moved to Johannesburg to still the SABC, to a little bit of radio, a little bit of TV. And after that, I worked for a media development organization, a US-based one called Internews Network. I lived in Kenya for 4 years then, and then I worked for them for 3 years in Washington, D.C. And then I came back to South Africa on a fellowship called the Knight Fellowship. And shortly after that, I started Bhekisisa.
Okay, so fascinating. And there as well, you can see like healthcare, but you did a different path going into journalism.
Yes, it was interesting for me when I did speech therapy. I didn't want to be a speech therapist, but I was very interested by the sort of like the research, the arguments, and the evidence-based nature of it. It's interesting that in journalism, the path that I chose to do is evidence-based journalism, which means you base all your stories on peer-reviewed studies and you bring that together with policy. But that is the part about therapy that frustrated me a little bit because I felt I couldn't do anything that's not supported by evidence. But it's interesting that I took that aspect and I'm applying it to journalism. But yes, I've traveled a road, that didn't start off with journalism, but the thing that really pulled me to journalism was that I felt that I could make a difference in the health and social justice world, and that I could be creative, that I wouldn't be held back by as to what am I going to focus on. I could follow my passion and then just sort of tell stories. And I was always pulled by broadcast. That was my initial, experience of journalism. And that's why I started off on radio. Yeah.
Yes. It's always fascinating how people get to where they are. And sometimes you think, oh, you could have just gone directly there. But no, you became the person who you are doing the route that you did.
Yeah, it's interesting, when they did those tests at school, sort of what should you become? No one really told me a journalist. It was always like a doctor or a social worker, and I didn't quite know how to bring those social justice and health aspects together. And journalism, in my case, presented an opportunity to do that.
So awesome that you found your calling. Yes, so let's jump into Bhekisisa. What does Bhekisisa mean?
So Bhekisisa is a Zulu word, which means to look at something really closely or to scrutinize it. So at Bhekisisa, we look at health policy issues really closely and we scrutinize it. We do most of what we do is something called solutions-based journalism. And the name of that is actually very misleading because it sounds like journalism that you talk a little bit about a problem and then you end with a few solutions. But it's actually something very different from that. It's a type of journalism, almost investigative journalism, where you use data to evaluate a solution or a response to a problem. So an example would be, say, if you want to look at how should sex work be regulated to bring down HIV infection rates, what works, what doesn't. So a solution that you could look at is what happens when you decriminalize sex work, when you make it legal to be a sex worker, what sort of effect does that have on HIV infection rates? And you would then use studies and data and combine it also with the lives of sex workers. Maybe in one country where it's legal, one where it's illegal, and then come to a conclusion. And it's not necessarily always, this is right, this is wrong. Sometimes it's a solution that works well, but there's a lot of challenges with it. So it's not good news journalism. It's journalism that really uses data very effectively to look at what works and what doesn't.
And I'm also hearing that it's also not journalism that's 5 seconds of, let's just quickly write something. And also it's not necessarily an opinion piece. It's like saying, let's look at the facts and share the facts with you so that you understand the facts.
Yes, and it's a little bit more than facts. It's interpreting the facts for people and the data. It's not everyone's cup of tea. You're right, it takes long because he's as a donor-funded, it'll be a non-profit, a donor-funded journalism organization. And solutions journalism is something that would be very hard in a mainstream newsroom to do because it's so profit-driven, which means that you need to work on stories so quickly. In our case, our journalists on average work about 2 to 3 weeks on a story, which is a big luxury in the news world today. And then our editing is very extensive. It's easily 15 to 18 hours per piece, because we go and read the studies ourselves. The ideal is that those number of hours do decrease as someone progresses with us, but when they start with us, it's easily 20 hours a piece. we go to the studies to see if it's been interpreted correctly, if the right part of the study was quoted, but we also go into the structuring of a piece. And our main thing is that I feel distinguishes Bhekisisa from other organizations is that we de-jargon our pieces. So we don't use any industry terms. We would write it in a easy to understand language, even though the people we try to reach is decision makers, right? It's not necessarily the general public, but there is so much competition online as to what you would read, even if you're a decision maker. So you would read the thing that's the easiest flowing and easiest to understand. But we also take our pieces and we syndicate it to mainstream partners. And we often get interviewed on radio and television on our stories. And if we want to reach those partners, we want a news editor at a mainstream organization to publish the piece. And it's not easy to understand. They're not going to do it. They don't have to publish it. Same with radio and TV producers. If the first 3 paragraphs aren't like really easy to understand, then they're not going to invite you for an interview. And that's the part that takes so long. And you know, Colleen, I find over and over, the better I understand something, the better equipped I am to say it in an easy way. The less I understand, the more jargon I start to use. So that is a part that really does take that 3-4 hours longer to do.
Yeah, before we go for a break, I agree with you that, you know, as soon as you realize the person doesn't understand it, then they come up with all their fancy jargon because, like, you won't realize I don't understand it because you don't understand it either. And yes, you know, it is about how can you explain it simply. What I've also noticed about Bhekisisa articles is that they're also like story format. They're almost like, oh, let's read this as a story, not like, oh, now we've got to sit down and write all these, read all these articles.
Yes, we try to give it a narrative form, and that in itself is also a time-consuming thing to do because you need to make sure the story is generally a story of a person, and you need to make sure that it matches up with the data in studies. And that doesn't just take time to figure out, but it takes time to bring it together in a meaningful way.
Yeah, and I think it's also very easy, like if you think, yes, we should legalize sex workers, it's very easy to go and find articles that support that. But you need to find the whole side of should we, shouldn't we, the anti, the for, the pro, every convoluted version of it.
Yeah, and often something isn't as straightforward as just legalizing it. There are often legal forms in between. You know, in the case of sex work, there would be countries, you know, that partially decriminalize it. And then you need to understand the legal concepts and the data and the science of HIV. You need to know how health services work, because if you don't, then you won't understand what difference legal or illegality would make to access of health services. And I think in the case of sex work, it's pretty clear, decriminalize it. You know, all the data almost points to if you decriminalize, health services becomes much more accessible. If you make it illegal, you don't see any decrease in the number of sex workers in a country. It makes really no difference. It's almost like abortion. All you do if you make abortion illegal is you make it unsafe. People don't stop having abortions. So making it possible to have safe abortions doesn't necessarily increase the number of abortions you would see. It would just really make it safer, which means that you will have safer or better maternal mortality figures. You will have fewer women dying because of pregnancy or birth. And in South Africa, we have actually got pretty good data that shows us how maternal mortality decreased 20 years. Excuse me. I'm very sorry, Colleen. I hope you can cut this out. Drink water.
No, we do real here,
Okay.
which includes coughing. Yes.
In South Africa, we actually have very good data that shows us 20 years after abortions were made legal, our maternal mortality actually decreased, you know, so that had a positive impact on it. And so, yes, as you say, it's not often as straightforward as just looking at an issue. It's about looking at if something, say, like abortions become legal, is it really accessible, and how long are waiting lists, does it really translate into a realistic and a reliable
And do we
service?
have enough staff? And do we take into account different opinions? Yes.
Yes. Do we have health workers who are trained? What do you do if a health worker, judges you? What about conscientious objection from health workers? They also have a right to that. So, I find it just fascinating issues. I think health really allows you to almost report on anything, because it brings together everything in society, from legal issues to economic issues to social justice to just having access to basic humanity. And I think that's why the area of health and health policy, I feel, is a very satisfying field for me to report
Yes.
on.
Okay, so on that satisfying note, let's go for a break. And then when we come back, we're going to hear more about your journalists, what kind of training they go through. And also, like, does someone buy your articles? How does it work? But first, let's go for a break.
How do you know the life or personal coach you're about to work with is who they say they are? How do you know if they can do the job? At the Africa Board for Coaching, Consulting and Coaching Psychology, we can tell you. So, before you share your secrets and spend your money, check with us first. Visit www.abccccp.com or call us on 012-751-7608. The ABCCP, the professional body for coaches.
Welcome back. You're listening to Healthcare Hour with Colleen Qvist. My guest today is Mia Malan. She is the founder and editor-in-chief of Bhekisisa, and Bhekisisa is a center for health journalism. So Mia, yes, quite fascinating to hear, like as you said, 3 weeks to write an article and like 18 to 20 hours to edit it. So it's not like a quick, yeah, this looks okay, off you go. So let's talk about journalism and the training of journalists.
So when we get journalists at Bhekisisa, the type of journalism we do is not a type of journalism their training prepares them for, not in South Africa. Because you need to, the main skill that you need is you need to be a critical thinker who can pay attention to a lot of detail and multitask a bit. And the more technical skills you need would be, you would need to be able to understand research methodology, because if you don't, then you won't know how to interpret studies. You won't know, did this specific study that you read, was there a causal link between, saying something works or something doesn't work, or was it just an association? And you wouldn't know whether the size of the sample group in the study, is something that can be generalized, or you may not understand how, subjects were selected. Was it in a randomized way or not? So when people start with us, because we give them such intense feedback on stories, they learn each story about how studies differ from each other, how to look at scientific data, and that skill of how to take that data and make it meaningful to someone, to not just go and quote a study, to quote it in a way that it's contextualized and make people understand why that result is important, and to sort of almost like contextualize it for the world in which they live. And obviously they need to understand, is a study result applicable to society now, or how many steps in between that and when it becomes reality do we still need to go? And for that, you need to understand how a scientific process works, but you also need to understand a bit about policy, because policy is the thing that makes science meaningful. The science really means nothing if it's not applied to real life, and the thing that you use to apply it to real life is to work it into a policy and of a government generally. So that you need to do. And then if you want to turn it into a story, you need to understand something about narrative journalism. And that's a skill that you develop. Not everyone develops it, but if you have a knack for storytelling, and by narrative, I don't mean just have a human interest story, you know, with a few colorful pieces in the story. They're sort of easy to understand translation of narrative journalism, if you do it correctly, would be that you use literary techniques that people would use to write a short story, a fictional short story, or a novel. And so you have ways in which you build a character or you build suspense, and you apply that to a story to essentially build appetite for people to want to read the data or to want to read the science. Because for most people out there, science is something that put them off. They don't, it's something that's hard at school, not everyone takes it. And actually, science is so important and can be so meaningful in everyone's lives. Everyone can understand science. I feel, you know, if we write a story and people don't understand the science that we had in there, it's not them, it's not dumb people, it's us who were dumb. It's us who did not do a good job of translating that science into something that people can understand. And they shouldn't just be able to understand it, they should get from that story why it's necessary in their lives. It must be meaningful to them. So that process takes on average, you know, like a few months to learn at Bhekisisa. So when they start, there's a lot of editing, but after a year, that editing generally drops by, you know, a third to half, of mostly by about half. And once we get to that level, then things go a bit quicker. But we also have a television program that's broadcast on ENCA, a monthly television program. It's also on our YouTube channel, and it takes one subject and then looks at it from different perspectives. You know, for instance, our last program looked at the at ketamine, which is a psychedelic drug, you know, for recreational use, but it's very well used in the anesthetic world for anesthesia. But now there's use that is spiraling to treat depression, and we would look at the science behind it. What is irresponsible use? You know, what does a clinic need? Who qualifies? Who doesn't? And you know, is it really working? And for who would it be working? And how do you use it? And you know, giving people an informed perspective and a science-based perspective on it, so that you, after you watch the program, we also do print stories on the program to take it a bit further, you would know what's good about it, what's bad about it, what does science say, what are the things to watch out for, and you know, why would it work for certain people? Because it does work for certain people. It's for treatment-resistant depression, and some people really have no other option. But how do you know when you've reached the point of no other option, when it becomes an option? Yeah.
Yes, so I think you're actually modeling the whole storytelling for us, where we can follow everything that you're saying, and it's like, oh, okay, what's the next bit now? Yes, so I can just imagine the TV show, and yes. So your journalists come to you, they're already trained journalists then?
Well, it depends what your definition of already trained is. You know, if you
Okay.
come out of journalism, I don't know if you're already trained. Maybe you have an interest in journalism, but you generally, when I say not already trained, you know, whichever newsroom you're going to end up in, you're going to have to learn that newsroom style.
Yes.
So you
Okay.
don't come ready packaged out of any school and
No.
end up in a newsroom. I mean, I didn't either. It's not just today that it didn't work that way with me either. I had to learn to do things in a certain style. So we, up until 3-4 years ago, so Bhekisisa started off in 2013, which is 12 years ago. And we were actually the newsroom, the help desk of the Mail and Guardian at the time. And we left the Mail and Guardian in 2019 to become an independent organization, and to be able to access all the online revolution meant that a lot of the audience of the Mail and Guardian got, you know, spread over other media organizations, and we wanted to access that. So up until the point where we still published in a print media publication, because when we left, and there's still a print edition of the Mail and Guardian, our formats and the kind of people we selected to come and work with us was different from the time that we started with our own website. So initially, I specifically only hired people who came directly out of journalism school, not experienced people, because I felt I would have to break down experienced people's way of journalism, and there might be a lot of resistance if you do that.
Yes.
And that it was easier to mold people
Teach the old
directly
dog
from.
new tricks.
Yeah. But it's interesting, as media changes all the time. Media, the pace at which media changes is just, it's almost horrific, right? I mean, it's a different thing every year. And how social media and the types of social media becomes really integral to what you do. So for instance, today, you can't be a journalist and say you don't do Instagram reels. You just not be addressing your job basically properly, or that you don't watch TikTok because there's not just dance
You don't
videos
use
on
AI.
TikTok.
Yes.
Exactly. So today I tend to be very much, I tend to use a lot of consultants, some senior people who may not necessarily want a full-time reporting job, but wants to do part of that. And I want to access their skills. So in our TV program, we have a lot of consultants on our team who are really skilled. So they're not fresh out of journalism school. They're really skilled journalists, but they're not necessarily not all of them are with us full-time. And in print, we are increasingly starting to access people that have a knack for our style. You look at how they write, but they may want to write books, and not do journalism permanently. So I do have a strong component of more senior skilled people who now increasingly start to work for us as consultants, as opposed to many years back where I just had full-time junior people who after a year or two of mentoring became really more senior. But it's a bit different now. Yeah.
Okay. All right. So it's break time already. When we come back to being paid for articles, how does consultancy work? And then, we'll go for that break.
The Africa Centre for Work-Based Learning is a professional development center for professionals who aim to improve their professional standing. This means that the learning programs we run are more than just academic programs. They are work-based programs that focus on leveraging your current experience as a professional to build your overall profile. A year down the line, the Africa Centre for Work-Based Learning is developing into a preferred centre for professional development in Pretoria, with 8 professional development faculties including accounting, teaching, entrepreneurship, as well as IT and many more. For more information, go to acwbl.org or dial +27 12 751 7608. The Africa Centre for Work-Based Learning, where work is learning.
Welcome back. You're listening to Healthcare Hour with Colleen Qvist. My guest today is Mia Malan. She is the founder and editor-in-chief of Bhekisisa. Bhekisisa is isiZulu word for scrutinize, and that's exactly what they do. They scrutinize all the information out there, all the facts, and they put it together in a narrative that is easy to follow, that the person also understands, well, why should they read this? And as Mia also explained to us, that sometimes people are scared of science, they go away from science, and they write in the way that you go into the science because you can understand it. We've been talking about your journalists that you now seem to bring in from a skill point of view, but also you can teach the skill. So my question is then, like, you write this article, takes 3 weeks. Is it then sold to all the different, I don't know what we want to call them, news distributors, radio stations, newspapers?
Yes, we call them syndication or publishing partners. So
Okay,
mainstream,
them.
legacy,
Yes.
for-profit news, newsrooms. So no, we do not sell our articles. We give it away for free. But the reason we can do that is because we donor funded. So we are
Yes.
non-profit, and we get funded by philanthropic organizations who have a strong interest in making information, health information available and accessible to the public. And that's why we cannot sell it, because we get paid to do it. You know, our
Okay.
salaries are paid for. We don't
Yes.
need to make money. And the kind of journalism that we do, specialist journalism, but donor-funded journalism, is something that really started to take off already 20 years ago, really. But in South Africa, yeah, Bhekisisa was one of the first non-profit newsrooms. There were definitely others as well. For instance, Amabukani, the investigative newsroom. Because the economic model of the news media collapsed with online. The economic model was advertising. With print publications before online, the news media had exclusive access to audiences and printing presses, because no one else had a platform where you could advertise and so many people are reached. And now that all changed, because it's online, anyone can have a website, and there's Google and Facebook, you know, it takes, you know, a lot of that away. So there were increasingly sort of like philanthropic foundations who looked at funding specialist journalism. So our funding in our case comes from not actually media donors, but health philanthropic organizations. For instance, the Gates Foundation gives us the most of our money. And we also get funds from the Wellcome Trust in the UK and from the Millennium Trust here in South Africa. But it's very, very clear when you're in this field of journalism, and particularly to us at Bhekisisa, that there's a very strong clause in each contract to say there will be no editorial interference. And although you can agree on principles, for instance, you know, if you match us up with the Gates Foundation, but both Bhekisisa and the Gates Foundation's interested in public health, you know, and policy and reaching decision makers. Those things you can link up, but we can't be told this is the angle that you need to take on a story, or from a donor that they want to see a story before it's published. They really don't see any of it until they see it when the public sees it. So that's a strong aspect that you always need to remember, that when you choose a donor who gives you money, that if it's a donor who's not prepared to do those things, it will impact on both your credibility and the donor's credibility, because no one would believe the information. So we give it away for free. And each story generally of Bhekisisa, if all our partners use it, which I would say is about in 70% of cases of stories, then it gets published 6 times. So once on our website and 5 times on the other websites. Our local partners are News 24, the Daily Maverick, Financial Mail, Times Live, and the Mail and Guardian, where we started off with. Yeah.
You'd be in trouble if you couldn't remember all the partners. All right. And then, so that's interesting. It's also about partnering with people who aren't going to force you to give their propaganda. But then, as the journalist or as the consultant, can you choose a topic I'm really interested in? Or are you assigned specific stories?
So it's a little bit of a combination of that. So for instance, we have one wonderful journalist, Sean Christie, who writes profiles for us. And sometimes it would be me saying, you know what, Sean, this guy has been in the news now. Let's do a profile about him or her. And sometimes it would be Sean who says, you know what, I met this incredibly interesting person. Can I do a profile on him? So it's a real combination. Or we would have, say, someone who has a very strong interest, one of our freelance correspondents, in HIV and the whole Trump, you know, the consequences of the Trump administration taking away funding from HIV projects in South Africa. And those would, you know, she may come up with a suggestion, but it's often a real collaborative effort. So coming up with a suggestion and saying, let's mold it into this way, you know, because this is what our job is to put in the media what hasn't been there. Our job is not to repeat what News 24 or some other mainstream organization does. Our job is to do the stuff that they can't do or can't afford to do. And that's why it would often, most of the time, be a conversation, and it would come up with, mold it in a way that would work for both the journalists and for us. And that would be based on what's been in the media, or what is it that decision makers need to be able to solve this or that problem. Well, you know, we want to help to set the agenda. And we want to help decision makers to know what to think about and bring the information together in such a way that it's helpful and not a burden to read the story. And that's why we're so strong on evidence, because if you deal with decision makers in a policy making process, you know, there are scientists, academics, the people who come up with the data, then there are the government officials, the politicians, and very often there are ordinary people in that process. For instance, if you're going to talk about abortions, you know, the people who need to push for the service would be women. It would not necessarily be activists, or they are the activists. So when we look at bringing all of that together, if we want to reach people like scientists and researchers, then we need to use evidence and data they take seriously. And they take peer-reviewed studies seriously. They don't take second-hand sources seriously. So that's why it's so important that we understand that part of it. And say if it's a process where, say, for instance, we recently did a story on ADHD, you know, and making medicine more accessible, to reschedule it as a more accessible form of drug with our medicines regulator. In that process, you would have a lot of teachers and parents who are part of that process to push for it, because they on the receiving end of having to teach kids who don't get medication and, you know, having to run a household with that. And in that case, the format that we do a story in, there might be an op-ed of, say, a psychiatrist, which we had recently, who would argue for this. But we would also make videos and Instagram reels, because that's where we're going to reach the parents and the teachers. And we would do podcasts or YouTube, you know, short inserts on it, because the op-ed is not necessarily the thing that a parent or a teacher will be reading. You need to, in today's media world, you need to look at who do you want to reach, and based on that, you decide on the format that you're going to have a story, and it's often multiple formats.
Yes. So I love your approach of not saying we only do print, we only do this, we only do that. The story is important enough to be able to send out into the world. We need to make sure that the vehicle that it goes in is going to reach the intended audience.
Yes, and I think, you know, something that has been very valuable for me in our field of journalism, donor-funded journalism, is donors always want to know that the money is spent well, and then they want to know, what did that money achieve? What's the impact of your story?
Yes.
And
what difference did it make?
Yes, and because that's not something that's as prominent in a for-profit newsroom. So if you're in the non-profit news world, there's a lot of pressure on you to develop methods to measure impact with. And for me, that has been incredibly valuable, because when I measure impact, I don't do it for the donor. I do it for ourselves, right? It would just be really a real waste of time if you just do it to impress a donor, because so that is why I've gone into the mode of, before I do a story, I think, who do I want to reach? Because I don't just do it because it's nice, or because, you know, I like reels, or I decide whether there's a reel or not on a story based on who is it that I want to reach. And then I need to think, there's a policy making process. Who would be the different people or groups of people who would be involved in this policy making process? And sometimes there are groups of people that you don't want to reach at a certain time. You want to focus on one part of that. Sometimes you want to just focus on the scientists for a certain story. So when it comes to something like lenacapavir, which is the 6-monthly injection that you can take to prevent yourself from getting infected with HIV. And, you know, for a long time, the scientists were really the sort of group of people that you wanted to reach. Now that has shifted, because we know the US government is highly unlikely to help or to stick to their commitment to pay for some of it. So now you want to do it in a way that other donors, the Global Fund, would, you know, try and stick to their commitment, but more importantly, governments finding money to make this available in their budgets. And then you're obviously going to move on. Once it becomes available, you're going to move on to how to get it to people. So you're going to move on to wanting to reach health workers as to what's the best way to roll this out. And you're going to want to reach patients, who really want it and who say we don't have it yet. It's not always everyone that you want to reach. I think it's quite an ineffective strategy to say you want to reach everyone with your story. It becomes too unfocused. Yeah.
Okay, so thank you so much. You've been fascinating to talk to. I think we just did a tiny little bit actually. And I think the training sounds amazing. It's like, oh, I'm coming for training now. I want to learn all these things. So thank you so much for making it exciting, for making it fascinating, for all the people out there thinking, oh, here's a career for me. Do reach out to Mia. Set up some job shadowing or do something. But yes, be in charge of your own career. So thank you, Mia.
Thanks so much for having me, Colleen. It was lovely talking to you.
All right, you've been listening to Healthcare Hour with Colleen Qvist. Please remember that you're loved, you matter, and you're not alone. I'll see you all next week.
The home of inspiration every day.
Most people give up on themselves easily. You know the human spirit is powerful.
From news,
Countries across the globe have been hit by the COVID-19 virus.
views,
There's a global trend to see an increase in GBV incidences, specifically domestic violence.
sports,
What's he say? It's a really good ball. It's Shabalala.
and music to inspire you every day. This is Vuka Online, your inspiration radio station.